Hello, my name is Matthew Hayes. I'm the Medical Director of the Wessex Cancer Alliance. This year in 2023, as many of you will be aware, we're celebrating the 75th anniversary of the founding of the National Health Service here in the United Kingdom. What fewer people realise perhaps is that in the same year, 1948, the World Health Organization was also founded, at a time of course following the Second World War, when so many countries around the world were struggling to provide healthcare for their populations. Things have been difficult for the National Health Service recently, and since the pandemic, we're all very well aware of the pressures that the NHS has been under. The publication last week, therefore, of the first NHS long-term workforce plan has been welcomed by many of us as an opportunity for us to look anew at the way we provide workforce to support the healthcare services that we all wish to provide. For those working in healthcare, providing cancer pathways to our populations at the moment, things are still very difficult, even though the pandemic has passed, with, for example, industrial action and the health economy struggling as it is. Fortunately, our providers of cancer pathways across Wessex, despite all the pressures, are able still to continue to provide high quality healthcare for our population, and we're very proud to continue to support them in doing so. We're particularly pleased that our ability to diagnose cancers at an earlier stage has continued to improve despite the effects of the COVID pandemic. The introduction of the fecal immunotest, both in bowel cancer screening programme and in patients presenting with bowel symptoms who are worried they might have a bowel cancer diagnosis, has made a huge impact on this. We remain, as always, so grateful for the efforts of all our care providers, from those working in primary care through those working in hospitals providing surgery, radiotherapy treatments and systemic therapies such as chemotherapy, in all their efforts to ensure that patients are offered the fastest possible diagnostic and treatment pathways in an effort to improve outcomes and experience across our patch here in Wessex. So in addition to looking back at the last 75 years with some pride at the achievements of the National Health Service, I think we should and can look forward with some significant degree of optimism and positivity about how else we can improve the healthcare of those with whom we live. So happy birthday NHS, and here's to the next 75 years.